Hi, I'm Corey. I'm Amber. And I'm Olivia. There are three major types of insurance in the U.S. Medicare, Medicaid, and private pay. Medicare has four parts. Part A includes hospital-based coverage. Part B includes medical coverage. Part C is called Medicare Advantage. And Part D is prescription drug coverage. You can qualify for Medicare if you are 64 years and 9 months old. If you already receive retirement benefits from Social Security. If you are eligible for Social Security benefits but haven't filed for it yet. Or if you or your spouse have a Medicare-covered government employment. Part A covers inpatient, hospice, home health, and skilled nursing facilities. If you qualify for Medicare, you qualify for premium-free Part A. If you do not qualify for Medicare, you can purchase Part A coverage. If you paid Medicare taxes for less than 30 quarters, you will pay $458 per month. If you paid Medicare taxes for 30 to 39 quarters, you will pay $252 per month. Medicare Part B covers medically necessary services, preventative services, medical research, ambulance services, DME, mental health care, and some outpatient prescriptions. Part B premiums are income-driven. In 2020, the standard premium amount is $144.60 per month. After meeting your deductible, you will pay 20% for most doctor services, outpatient therapy, and DME. Part C is the Medicare Advantage plan. Medicare partners with private insurance companies to provide Part A and Part B benefits and typically prescription drug coverage. This is an all-in-one alternative to original Medicare. The plans offered by Part C are PPOs, HMOs, PFFS, and SNPs. The costs associated with Part C are dependent on the plan you choose, but typically include premiums and copays, in addition to your Part B premium. Part D is prescription drug coverage. It is an optional benefit offered to everyone on original Medicare. Some Part C plans include Part D coverage too. Cost depends on what plan you choose, what drugs you take, and your network providers. You will pay yearly deductibles, copays, and premiums. Part D covers a specific list of generic and name brand prescription drugs. Part A covers up to 100 days in a SNF after a qualifying hospital stay. The first 20 days are covered at 100%, days 21 to 100 require a 20% copay, unless the patient has secondary insurance. Part B covers stays that extend past 100 days, or situations where the patient did not have a qualifying hospital stay. Medicaid provides coverage to over 60 million low-income individuals in the United States. Medicaid is administered by the states, according to requirements set by the federal government. The program is funded jointly by the state and federal governments. In 2010, the ACA expanded eligibility to almost all non-elderly adults with income at, or below, 138% of the federal poverty line, which is around $17,000. Medicaid covers children, pregnant women, parents, seniors, and individuals with disabilities. Eligibility is based on household size. For a one-person household, the maximum income is $17,609. The minimum income increases with household size. The federal government laid out these benefits as mandatory. This means the states have to provide these benefits to those on Medicaid. The benefits listed here are considered optional by the federal government. This means that the states can choose benefits from this list that they wish to provide to those enrolled in Medicaid in their state. As you can see, occupational therapy is listed as an optional benefit. Each state can design their own Medicaid plans, as long as they include all of the mandatory benefits laid out by the federal government. Most Medicaid enrollees receive care through managed care organizations, MCOs. MCOs are organizations with a network of primary care providers, specialists, hospitals, and healthcare providers. States can impose co-payments, co-insurance, deductibles, and similar charges on most Medicaid-covered benefits. Amounts vary with income and by state. Medicaid is an agency of the Department of Health and Human Services. Medicaid is one of the largest payers for healthcare in the U.S. The federal government matches state funding for Medicaid. State contributions vary state to state and is related to per capita income. The final type of insurance we will talk about is private pay insurances. Private health insurance refers to health insurance not offered by state or federal governments. They include marketplace plans, health insurance offered through employers, and plans offered by licensed brokers or agents. All plans must meet requirements set by the ACA. Here are some types of private insurance plans. The high deductible plan means you pay a lower monthly premium, but will spend more for health care before your insurance kicks in. The low deductible plan means you pay a higher monthly premium, but will spend less for health care before your insurance kicks in. Catastrophic insurance provides coverage in times of emergency, and also preventative care. A health savings account is basically a savings account that you contribute to for your healthcare needs. Some examples of private health insurance companies are Blue Cross Blue Shield, Aetna, Humana, United Healthcare, Cigna, Optima, and Kaiser Permanente. Each private insurance company can choose what to include in your insurance plan. Plans also depend on what your employer is willing to cover. Here is a list of possible benefits that can be covered by your insurance. Some limitations of private insurance are that some plans don't cover children that are developmentally delayed. Some plans require new physician referrals every 12 months. And companies can choose what they want to cover and what they don't.